Well, good morning and welcome to this very special edition of the Balancing Act presents Behind the Mystery of Wilson Disease.
It's a rare inherited disorder in which the body's pathway for removing excess copper is compromised. And over time, this results in copper levels building up in the liver, brain, and other organs, leading to damage that can greatly impact a patient's life.
Today, an overview for patients and caregivers featuring a neurologist and a hepatologist who are part of the patient care team.
Plus, we're bringing together advocacy and industry with an exclusive in-studio interview with the Wilson Disease Association and Alexion Pharmaceuticals.
And at the heart of it all are those who are living with the disease. Let's meet a young woman whose diagnosis changed her life. Take a look at this.
I started experiencing symptoms in my childhood. I always had headaches. I always felt nauseous, but when I was in nursing school, that's when my symptoms really came on. I had trouble cutting food, blow drying my hair, brushing my hair. And I noticed I started to slur my words and just having a difficult time speaking. My hands were always tremoring and shaking. It was hard for me to even keep up with nursing school. When I went to see a doctor for my symptoms, it seemed that there was always an excuse, either stress, anxiety from nursing school. The blood panel that my primary ordered did test my hepatic function, but my hepatic function was normal. I never had any further testing or workup on my symptoms.
Wilson disease can affect the liver in three distinct ways. Those that have a slowly progressive form of liver disease, they will have usually no symptoms at a time when they have just an elevation of liver enzymes in the blood tests. As the disease progresses, they may develop then yellow discoloration of the eyes or skin. They may develop swelling of the abdomen with fluid. They may present with abrupt bleeding from the upper intestinal tract. A patient who has acute liver failure due to Wilson disease, that is a medical emergency that requires urgent liver transplantation to survive.
Wilson disease can present with a wide variety of signs and symptoms, from abnormal movements, such as tremors, personality changes and behavior problems like depression and anxiety. There can be problems with day-to-day tasks due to trouble with fine motor coordination, problems with speech and swallowing, abnormal drooling. There can be balance and walking problems. So one of the places that copper can build up is in a layer of the eye near the cornea called the Kaiser-Fleischer ring. It's a yellowish golden pigmentation that can be seen using a special test called a slit lamp exam that an ophthalmologist can perform.
When I first heard about Wilson disease, I was in nursing school. My professor mentioned the hepatic effects of Wilson disease and didn't go into the neurological symptoms. And she also said you would most likely never meet anyone in your career with this disease because it's so rare. I was driving past the optometrist office one day. I didn't have an appointment, but I decided to stop in there and just get a new pair of glasses. The optometrist noticed copper deposits in my eye, and he did a slit lamp exam and saw Kaiser-Fleischer rings and asked if I had Wilson disease. After I saw the optometrist, my primary care doctor referred me to a neurologist. The neurologist ordered a brain MRI, more blood work, and they did another slit lamp exam. The test showed copper accumulation in my brain, my liver, and my corneas. And my diagnosis of Wilson disease was confirmed. I remember feeling scared and also relieved at the same time, knowing that I finally figured out what was wrong with me.
Early diagnosis is key to enable intervention as quickly as possible to help reduce the risk of worsening organ damage. Diagnosis is complicated, so a range of tests may be used. These can include blood and urine tests, a liver biopsy, an eye exam, and sometimes genetic testing.
Once we have a provisional diagnosis of Wilson disease, we send off confirmatory genetic tests and test family members as well for the genetic mutation associated with Wilson disease. The next steps are then to assess the severity and impact of the neuropsychiatric signs and symptoms, and then we make a comprehensive plan with the patient to manage their symptoms. At the time of diagnosis, it can be a challenge to assess the severity of the disease and how much of the symptoms that the person is presenting with are reversible or treatable. Part of our focus is to ensure that symptoms don't worsen, but we often can't predict how much of the existing symptoms will improve. Adherence to the management plan is really crucial in preventing further copper buildup in the organs of the liver and the brain, and in preventing disease progression. Unfortunately, despite adherence to the management plan, some patients with Wilson disease still experience progression of neurological symptoms or may experience progression of their liver disease.
My approach to the diagnosis and management of Wilson's disease patients with liver disease involves 4 phases. The first and the very key phase is an accurate diagnosis. We want to next stage the amount of scarring or fibrosis of the liver. When we now have the staging complete, we turn to the therapy to remove the concentrations of toxic copper within the body, and in this organ, the liver. And we do that usually by using one of 2 FDA-approved oral drugs called chelating agents that bind copper and eliminate it in the urine. Now, it is also possible in individualized case management to add zinc as an adjunct therapy. In addition, they are most often prescribed a low copper diet. And finally, we get to the issue of maintenance. We're using blood tests and urine tests to measure copper, and these tell us where we are in the phase of decopperizing the body. The same tests will tell us whether or not a person is not adherent to their regimen, because they will start to show evidence that copper is reaccumulating. We can also perhaps see that in a rise of liver enzymes and are now moving out of the normal range as copper reaccumulates in the liver.
Industry and advocacy are pillars of the rare disease community. Let's meet 2 leaders in the space.
My name is Wendy Erler. I'm the Vice President of Patient Insights and Experience at Alexion AstraZeneca Rare Disease. I'm focused on listening and learning and engaging with patients and caregivers, understanding their needs and wishes for the future, and creating ways to meaningfully incorporate these insights into our decision-making every single day.
I'm Rhonda Rowland, and I'm on the board of directors for the Wilson Disease Association. Communicating health and medical news and information has been my lifelong career. My interest and passion comes from my own diagnosis with Wilson disease at the age of 21 when I was a senior in college.
When we come back, our exclusive in-studio interview with Wendy Erler and Rhonda Rowland. Stay with us. Welcome back, everyone. Joining us in our studio are Wendy Erler, Vice President of Patient Experience and Insights at Alexion Pharmaceuticals, and Rhonda Rowland, who is on the board of the Wilson Disease Association.
Absolutely. Thank you so much, ladies, for being here with us this morning.
Thank you.
Sure, absolutely. Rhonda, why don't you take us on your journey for a little bit and let us know how you got involved with the Wilson Disease Association?
Started my career as a communications specialist. I went and spent 16 years at CNN as a producer and an on-air correspondent in the medical news unit. And then I found on the internet about the Wilson Disease Association, and they were looking for someone to write about liver transplantation for their website.
What a great fit.
And then in 2020, I joined the board and helped with some of their conferences and revamping their website, and got involved from there.
So, Rhonda, what information does the Wilson Disease Association provide to the community?
We provide information about the disease, resources about research and studies. We hold conferences and host webinars, and we help with fundraisers. We have support groups. So anything to try to help people with the patient journey and connect people to others with the disease, because that support is so important.
It really is. Wendy, I was reading here that Alexion has 30 years of leadership in rare diseases. So what work is being done to incorporate the patient voice and experience into the company's efforts, including research and development?
We work really hard to make patient centricity real. It's not just words on a wall at Alexion, it's truly embedded in everything we do. And we create meaningful opportunities to partner with patient advocacy groups like the Wilson Disease Association and the American Liver Foundation. And then through those partnerships, we are able to engage with patients and caregivers. We bring them in, we meet with people all the time, and we really listen and learn from their experience, use those insights that we hear, and incorporate those into our development programs.
Can you tell us a little bit more about Alexion's engagement with the overall rare disease community?
We are very fortunate to work and be solely focused on rare disease research and development. It's so important to raise awareness for rare diseases and to ensure that treatments are being developed for these very uncommon conditions. Also, a lot of our work is focused on accelerating the path to diagnosis. Oftentimes, it takes a very, very long time for rare disease patients to be diagnosed.
Rhonda, from an advocacy and patient point of view, how important is that two-way dialogue?
Oh, it's critical, because first of all, who knows the patient experience better than the patients themselves or their caregivers, and what that day-to-day quality of life is like. And so we work hard to communicate that and make those needs known to industry. And then at the same time, we want to know about the latest research, the latest studies, the clinical trials that we may want to get involved with. And so having that two-way conversation is very important.
Well, Rhonda, I mean, we're doing it here with the Behind the Mystery, and we're making people aware of rare diseases, but there needs to be so much more awareness out there. How can we convince the media, or what do we have to do?
Well, you're absolutely right. And certainly the media, and then in turn, the general public, they're more aware of diseases that affect a large number of people. But if you put it into context with rare diseases, the number of people who suffer from them, if you look at that as a whole, it's much greater than any single disease. So you really have to put it in context that way. The media does a great job around Rare Disease Day. So we need to touch on those issues more throughout the year.
365 days a year.
Absolutely.
Rhonda, you shared your story. It's been 40 years. What have you learned?
Well, the biggest thing I've learned is we are all different. As I shared earlier, my disease is primarily a hepatic or liver form of the disease. Ginta is neurological, and Ed, who is featured in your first Behind the Mystery story, his is psychological. And so some people have a combination of all of those things, and that's what can make it so difficult to diagnose. The other is compliance, and that is following what your doctor suggests to manage your disease. That is just so key.
And community, how important is that?
Community is so important, particularly in rare diseases. People who suffer from these conditions and their caregivers often have to explain and tell the story and explain these symptoms, and it gets very exhausting. Coming together as community raises awareness and spreads more information. It's really critical.
Love what you're doing.
Thank you so much for being with us this morning.
Thank you.
Thank you.
Great information and great awareness. Thank you. And when we come back, we're going to see how Ginta manages her condition. So we'll be right back. Stay right there.
welcome back. Let's hear more of Ginta's journey after she was diagnosed.
We're going to show you how important a support system really is. Take a look.
It's been 6 years since my diagnosis. I was lucky to be diagnosed as early as I was because I'm able to manage my symptoms. The doctors prescribed me medication to lower the copper in my body, and I also followed a low copper diet, as well as physical therapy several times a week to work on my motor skills. Slowly, I started noticing improvement in my neurological symptoms. My doctor ordered genetic testing to see if my brother had the genetic defect, and he did not. In following up with my hepatologist, my blood work for liver function testing was normal, but the imaging did reveal scarring on my liver. I see my hepatologist every 6 months and get ultrasounds of my liver, as well as MRIs to monitor my liver and make sure it's not progressing. I follow my doctor's management plan and follow up with them as needed.
Because that Wilson disease management involves this sort of slow but steady progress towards normalization, by definition, it requires ongoing monitoring with your healthcare team. You need to be engaged with your healthcare providers and have the input of your team, and that they receive your input of any kinds of symptoms or problems you have that may or may not be related to Wilson disease, so that we can optimize your health.
Wilson disease affects many different parts of the body and many different aspects of life. And for that reason, a multidisciplinary team is really important for managing the disease. And that means including gastroenterologists and hepatologists, psychiatrists, neurologists, social workers, genetic counselors. A dietitian or nutritionist can be very helpful in guiding strategies for keeping a low copper diet. Many patients with Wilson disease will also benefit from a multidisciplinary rehab team, which may include physical therapists, occupational therapists, speech and language pathologists, as well as physiatrists. After an initial diagnosis, it's really important that people with Wilson disease follow up closely with their treatment team. Oftentimes, they will need regular blood work and urine tests to assess how well the management plan is working. We also routinely will do a neuropsychiatric evaluation and examination at each visit. And those visits can occur sometimes every month or every few months. Over time, once they've achieved a stable level of copper and the control of the disease is stable, those visits may go to twice a year, just to ensure that regular monitoring of their liver function and other tests are able to be done on a routine basis. These are all key to staying as healthy as possible.
I am currently working as a nurse in oncology. Some things that bring me joy in my life are cooking, spending time with Devin, taking my dogs on a walk, gardening, taking care of my plants, and traveling. Wilson disease affects my daily life as I have headaches, fatigue, nausea. It's difficult to be on my feet working full time. I'm lucky I have a partner, Devin, who helps take care of me and things around the house, cooks me dinner, and he makes sure that I rest and take care of myself. Wilson disease has changed my life for the better. I enjoy little things in life and don't take moments for granted.
Well, thank you all for watching The Balancing Act presents Behind the Mystery of Wilson Disease. If you or someone you love suspects that they have Wilson disease, see your doctor immediately for testing.
For additional information, visit wilsondisease.org, liverfoundation.org, rarediseases.org, and you can always visit our website, thebalancingAct.com.